I was born on September 25th, 1957. See my picture? I've always been a good-looking man. My looks earned me the prettiest girl in college, and together we made some fine children. They're all working and doing well for themselves, and now, well, they're taking care of my pretty college sweetheart too. My name is Jacob Williams, and not only was I born on September 25th, but I died on that very day this year. I just wish that heart attack I had would have turned out a whole lot different. Maybe when my wife called EMS, I'd have gotten one of those EMS teams that's part of that mission Lifeline. And maybe they'd have a 12-lead ECG, GEC, well, you know, that equipment I heard about, and they would have been able to start working on me right then. They'd also tell the doctor that I'm on the way to the hospital best able to treat this heart attack. Maybe, just maybe, I'd still be here taking care of my girl of almost 30 years. Lord, please take care of my family and especially my girl.
We all have a story, and we pray each day for the kind of network growing in South Carolina, Mission Lifeline, that brings together emergency doctors and nurses, cardiologists, technicians in the cath lab, and EMTs and paramedics.
It's raised our level of care. It's allowed us to invest in some new equipment and additional training, which has increased the level of knowledge and our abilities for caring for our population.
South Carolina is a leader in the nation for the number of people who suffer from heart disease. Research shows that heart disease is the leading cause of death, killing more than the total number of people who die of all cancers, pneumonia, influenza, and car accidents combined. Mission Lifeline works to help change those grave statistics. It works for the South Carolina Hospital Association.
South Carolina Mission Lifeline is probably one of our best success stories in the state, as far as getting hospitals and physicians, EMS personnel and agencies to come together around a common purpose to improve the care and outcomes for heart attack patients in every part of the state. So I think it really has been a concerted, collaborative effort.
Specialists and experts from various agencies in the state are working together to save people like Jacob Williams.
There's been a really big difference since we've been transporting patients emergently. Now we have a system. If a patient walks in the door, we have an EKG done within 10 minutes. Once we see the EKG and identify the STEMI, the ST elevation MI, we immediately contact the facility that we're transporting to and initiate transportation immediately while we're talking to the physician. So there's been a huge change in that.
Changes that have proved successful in keeping people like Ronnie McAllister alive.
Christmas Day, we were preparing to have lunch, a family affair, when my valve and aorta blew out in my heart.
This is not your standard acute heart attack.
A lot of times people will say, "Oh, hey Ronnie, good to see you." That phrase, "good to see you," you can't know how that rings now. That I'm so glad to be here that somebody can see me and I can see them.
The list of partnering organizations is long, but we need every group involved.
Our role is to be an intake hospital for people with cardiac disease that need immediate care. Those are people having what we call STEMIs, which are ST elevation MIs. And what we do is we take those people in, assess them rapidly, and transport them to the closest facility that can handle the problem.
There are 17 hospitals in South Carolina working with Mission Lifeline to provide interventional cardiac services and patient advocate representatives. Bon Secours St. Francis Health System is one of them, but the collaboration is much wider. The American Heart Association, South Carolina Hospital Association, the state's chapter of American College of Cardiology, and the College of Emergency Physicians.
You know, you got to give credit to the Lord. He put those people there.
Also involved, South Carolina Department of Health and Environmental Control, Office of Emergency Medical Services.
It's not just one person or one entity. It requires everyone.
It requires every organization participating. The goal of South Carolina Mission Lifeline, part of the American Heart Association's community-based national initiative, is to improve quality of care and outcomes in heart attack patients by improving the healthcare system's readiness and response to patients with ST-elevated myocardial infarction heart attacks, known as a STEMI heart attack. The goal is to reopen the blocked artery as soon as possible because the longer the heart muscle is deprived of blood flow, the more it dies.
Time is muscle. The quicker that we get the artery open, the less heart damage it is, and mortality decreases as your, what we call door to balloon time, how quickly you open the artery. The quicker you open it, the better your mortality rates and the more people survive heart attacks.
The purpose is to have physicians share more information on how to care for heart attack patients, determine where a patient can receive the best treatment in a region, and what facilities need better equipment or more training.
Our traditional process for taking patients into a hospital that was having a MI was that we would take them in, they would see the nursing staff at the facility, they'd be placed in an emergency room bed. At that point, the staff would confirm our diagnosis, they would go get the physician, he would review it, and then move them on to the cath lab. With this new process, what we're seeing is once we've transmitted our information to the emergency room, we go straight from our ambulance into the cath lab where they get the treatment they need, and it eliminates those extra steps, which saves a good bit of time.
It also means other changes too, like establishing common performance goals and creating a system in which medical workers, such as paramedics, can make one call and notify everyone on a cardiac team that a heart patient is en route to a facility.
Life-saving, definitely, and it also prevents any permanent disabilities, and the worst outcome would be death.
Mission Lifeline works and consists of early recognition by patients and bystanders of heart attack symptoms, early activation of 911, training of EMS personnel, ensuring EMS responders are equipped with 12 lead ECGs. It takes a 12 lead to identify a STEMI, and identifying hospitals that have services available 24/7 to open the artery, and then routing patients to these hospitals.
A STEMI, there are 20, 30 steps that have to happen from the time that the patient realizes their symptoms are something that needs medical treatment, activating the 911 system, the EMTs arriving on the scene, activating the system, letting the hospital know that the patient's coming, which sets off a whole cascade of events that happen at the hospital so that when that patient gets here, we're ready.
South Carolina's STEMI initiative began in 2006 by establishing the vision, mission, and goals, organizing and engaging all of our key partners. In 2007, we began development and implemented the strategic plan. The group obtained consensus that percutaneous coronary intervention, PCI, is the preferred method of reperfusion. Mission Lifeline also began implementing multiple EMS, emergency departments, and physician processes.
I will say that there's several circumstances that the patients have walked in the door, and we've had them in and out of our facility in 20 minutes and to the hospital within 30 minutes. And transporting to St. Francis, Greenville, and EdMed, both are about 20 to 30 miles. So that in itself is something that we're very proud of.
3 years later, in 2010, Mission Lifeline began regionalization from the Lowcountry to the Midlands and the Upstate. Now this year, Mission Lifeline is increasing partnerships with EMS, collecting more useful data, participating in multidisciplinary meetings, increasing adoption of best processes at PCI hospitals, and have a greater STEMI system collaboration.
We said, let's come together. Let's look at trying to create a standardized approach for how we assess patients from the point of when they initially contact EMS, that 911 system, to when they've had the intervention completed. And so everybody came together and said, this is the way we should be doing this, and made a commitment to each other and to their patients that we would create a system that would work for everybody.
The future of Mission Lifeline focuses on better engaging the people driving change, increasing Mission Lifeline registration and participation, increasing hospital recognition, initiating hospital accreditation, accessing the impact of Mission Lifeline, and developing benchmarks and protocols to treat sudden cardiac arrest.
You've got to look at your data. How many patients are you dealing with? What are your times? And then when you dig down on where your times are, you can figure out wow, we're really slow going from the ED to the cath lab, or really slow once we get to the cath lab getting the artery open. So I think data is power when you're talking about Mission Lifeline and STEMI care.
Now they're actually having much more function because we're preventing significant harm to the heart muscle, and we know that we're causing people to be able to survive heart attacks that may not have survived before. And so it's really making a difference in patient care and patient outcomes.
Treating and saving people like Jacob Williams so they won't have to tell their stories from the grave. Thank you for living up to the mission, a lifeline for those we serve together in our communities in South Carolina.